2018. My name is Terry Fletcher. We're going to go through some information, not only that has come through from ICD-10, but also from CPT, and also things that have updated with Medicare as well. So we're going to focus on the cardiology specialty, but you will also see some information that will cross over into some generic and medical specialties as well, but it does have impact from a reimbursement perspective for cardiology. So we're going to go ahead and get started. You should have a PowerPoint presentation in front of you. If you don't, just please look on your screen through the webinar service and you'll be able to see that. So a couple of things. We have the ICD-10 guidelines that were released. We know those were released October 10th, but they're really for the reporting guidelines for the 2018 fiscal year. So there's 117 pages. They posted their guidelines. The Centers for Disease Control and Prevention have posted the guidelines on their website. We've included that for you on slide 2. And then make sure you know that these guidelines apply to October 1st, 2017 through September 30th, 2018. ICD-10 tries to, which is how we diagnose patients, they try to give you some information that will allow you to be updated before you have to dive into CPT starting January 2018. So just be aware that there's some, just when you're reviewing this information and these guidelines, and we actually did present ICD-10 in the totality of it back in August. So if you're still looking at some information there, you want the whole presentation, please contact Audio Training Online, and they'll be able to get you that. But just as far as our snapshot here, when you review the guidelines for this, make sure you're looking at narrative changes will now appear in bold text. Items underlined have been moved within the guidelines since the fiscal year 2017 version. And then italicized areas, that's some heading changes, so they have changed some things as well. There's also conventions for ICD-10, and those are the general rules for classification. They're not the coding and reporting rules. They're basically saying this is why we do that. They're independent of the guidelines. There's 19 conventions, and they go kind of coincide with the guidelines. It's almost a help book, if you will. So for example, convention number 15, it has a quote-unquote with. That's some revised narrative. So every coding professional, when you read it over, you'll see highlighted in blue font the word with or in is interpreted to mean associated with or due to, and it appears in the code title or the alphabetical index or instructional note in the tabular list. Now these conditions should be coded as related even in the absence of provider documentation, so explicitly linking them. So unless the documentation clearly states the conditions are unrelated, or when another guideline exists that specifically requires a documented linkage between two conditions, then you know that that may be something that has a causal effect or an indirect linking as well. Here's some new codes and some new ways to look at things when it comes to cardiology on ICD-10. So on slide 3, we have acute myocardial infarction, so AMI is our acronym. So you know that we actually changed from ICD-9, where we now have 4 weeks as the time period from time of incident. That was revised from 8 weeks from when we had I-9. We need episode of care, so ICD-10 does not capture an episode of care as far as that 7th digit, but you still have to include it in the narrative. And then you have subsequent AMI, and this is why. So we do have initial and subsequent, we just don't have it as part of a 7th digit designation character within the I-10 code. So the subsequent AMI allows coding of a new heart attack or new myocardial infarction that occurs during the 4-week acute period of the original AMI. Sometimes when you have that weakened heart that already had a heart attack, sometimes the patients will have multiple, which is really unfortunate, but it usually happens in a pretty, quick period of time, and it's kind of like an earthquake that has, recurring tremors, and that's what you're looking at there. And now we have a new designation, diagnosis to better descript when ischemic heart disease is involved. So now we have type 1 MIs and type 2 AMIs. And so type 1, they revise the definition. This is really, I don't want to say you're generic, but the I-21 series, that's your acute MI infarction. So that's the kind of the definition to that. And then when you get into STEMI versus non-STEMI, the new MI